Good morning. Thank you, Katie. It is my honor to represent Wellstar today on this important health briefing. I hope to provide you a perspective of what we're seeing throughout our health system and in our hospitals, along with thousands others of healthcare providers and caregivers during this pandemic. You're all very aware of the ongoing surge that we're seeing now, the skyrocketing number of cases in our communities and the hospital admissions. This fifth wave has been incredibly challenging as we've seen the easy transmissibility of Omicron impact the basic services of all our lives, including transportation, sanitation, and yes, healthcare. I'd like to provide you with some updated numbers of what we're seeing within our hospital. In doing so, I'll take you on a journey with a patient and a true story of a family's interaction with healthcare during this pandemic. We meet our patient, who's a 70-year-old gentleman. It's a typical morning, and he calls his daughter, who lives in his same neighborhood. You see, he's fallen and needs assistance. Living in the same neighborhood, his daughter immediately goes over and checks on her father. And instead of activating EMS, she realizes that he needs assistance getting up, but she's able to help him to her car, and she drives him to the hospital. While there, she learns that there are restricted visitation because of high levels of transmission in the community. She learns that at Wellstar Health System, there's currently 686 patients admitted with COVID in the health system. She also learns that a lot of people, like her father, are admitted for other reasons, but also subsequently diagnosed with COVID. She hopes this is not the case for him. She also learns that 69% of the patients admitted of COVID positive are unvaccinated. And 118 of those who are COVID positive required ICU level care, and 76% of those are the unvaccinated. 60% of people in the ICU, 60 number of patients admitted to the hospital with COVID requiring ICU level care are also requiring ventilator support. And an increased number of those, our percent 78, are unvaccinated as well. As she waits for news on her father, she subsequently learned he suffered a hip fracture. And yes, his fall from dizziness and weakness was contributed from a new diagnosis of COVID-19. Our story doesn't end there. You see, his daughter subsequently comes down with COVID-19. And 8 other family members subsequently from this one incidence of healthcare need is subsequently diagnosed with COVID-19. One pauses to ask, what if? You see, this family, unlike any others in our community, relatively healthy, all 10 members eligible for vaccination, yet none received their vaccinations. Because they interacted with each other on a family basis and regular routine, precautions were not taken when interacting. So mask wearing was rarely used amongst these family members when circulating the community, and no precautions about gatherings or large groups was adhered to. You see, the story has a devastating ending. That family no longer has 3 family members present because of COVID-19. This is a striking number of people who died from one single family out of infection from COVID-19 in one incidence, 30%. While one would be devastating, we hope that no one succumbs to this illness and no one needs hospitalization. One continues to ask, what if? How might this have been prevented? Well, certainly vaccination is our best prevention, and we'll continue to learn about that today from other speakers. But also wearing a mask, washing your distance, and washing your hands are also very important. I understand there's a lot of confusion about masks out there. First key point I want people to remember is snug fit. It's got to fit tightly against the face, no matter what fabric it's made out of. We know and have learned that the specialty fabric making N95s and KN95s are our best fabric to use if that's available to you. If not, it's multiple layers of a snug fitting mask that provide your best protection. Certainly getting medical attention if you're symptomatic, getting tested early, and getting treatment early are very important. We'll learn more about that today as well. But also, if you've been exposed, make sure you quarantine and get screened by getting tested either a home test or at your local healthcare institution. I think these are very important because, see, these could have helped this family survive and avoid the devastation which has happened. These are heartbreaking stories that we see every day. As one of the largest health systems in Atlanta, we see a great deal of misinformation and try to provide new, correct, and accurate information to our communities. I understand that there's a lot of mixed information, rapidly changing data, and recommendations coming out from trusted sources. I want to thank you for your flexibility, your understanding, and yes, your resilience, because we're all navigating this together as we combat this pandemic. My first ask is that you take care of yourselves and one another by getting vaccinated and participating in these protective measures such as wearing your mask, watching your distance, and certainly avoiding large crowds. If you're ill, stay home. Wellstar Health Systems is proud to serve its communities and ready and available to you today and every day. And we thank you for your support and your partnership as we lessen this devastating impact that COVID-19 has had on our communities.